guys, so it's Kayla, and last week I did not film a video unfortunately, but this week I am back and better than ever. So if you don't know, May is the month of awareness for borderline personality disorder. So what is BPD? BPD is a mental illness characterized by instability. Instability in moods, your relationship, your goals, your career, your self-image, all of that is kind of what BPD is all made of. In other words, BPD affects people, and the people who have BPD change frequently. Their thoughts change, their self-image changes. Personally, me, I have BPD. My view of myself changes all the time. And people with BPD, which is basically 2% of adults, this does affect mostly young women, can suffer from intense times of anger, depression, or even happiness and anxiety. And this can last for a few hours or a couple days. So BPD affects everyone differently, and it mostly depends on the person who has it. The person who suffers from BPD can exhibit self-harm, drug abuse, and other impulsive activities, which I will touch on later. Because someone has BPD, there are frequent changes and there are cognitive distortions, which is kind of like a change in self-image, being disoriented in what you like, what career path you want to go into, and things like that. And also people with BPD can view themselves as unworthy of love, bad people, and just people who don't deserve nice things. I know for me that I definitely view myself as someone who doesn't deserve love or doesn't deserve kindness. People with BPD will often feel isolated and lacking in support, and this also comes from not having a physical person here means that they cannot have an emotional connection, which is part of the disorder, and fear of abandonment. And it's really messy, and I don't like it. As a person with BPD, I know that if someone is not with me, then I kind of wonder if our emotional connection is still there, if we still have a relationship or not. This results in impulsivity that tries to get attention and tries to get the needs met. Along with BPD becomes a favorite person or intense attachment. A favorite person is someone that you have an intense attachment to. Your favorite person, you know, this is the one person that you idolize out of all the rest, and you can have multiple favorite people. Because of these intense attachments, it causes you to feel extremely happy one second, and if a person criticizes you or disagrees with your opinion on something, you split, and you instantly go from idolization to this pure, like this hatred, this dislike, this anger towards this person, and it can go away, but that's just how it is. And it's not really, for a person with BPD, there's no gray area. There's black and white. This person agrees with me, this person doesn't agree with me, and they hate me. And that's not true, but that is how a person with BPD thinks. This range, going from idolization to intense anger, is called splitting. BPD is a very common and undiagnosed disorder. Many people don't get diagnosed, or many people get diagnosed as something else, as bipolar disorder or depression, which are common elements to borderline personality disorder. Usually, if someone has borderline personality disorder, they will also have depression or general anxiety disorders or anything above. But as BPD is not as well talked about, it actually affects more people, 6 million US citizens, than it does bipolar disorder. So BPD, while not as well known, is actually more common. People with BPD, including myself, are incredibly sensitive to rejection, criticism, and so when someone gives that to us, we kind of either react with anger, which is the splitting on that person. We accuse them of not loving us at all, not caring about us at all, when really that person is just trying to help us in the long run. And this is kind of like a fear of abandonment, which stems from the difficulty, which I mentioned earlier, to be emotionally connected to a person when they are not physically with you. Feeling abandoned can come with impulse actions and many other things, which I've already talked about. These impulsive actions can include excessive spending, binge eating, risky sexual activity, irresponsible drug use or alcohol use, and many, many more. Like I said, BPD does occur with other things: depression, substance abuse, etc. What causes BPD? Many researchers have said that BPD is caused by childhood and teenage experience trauma. It can also be caused by not being taught how to deal with your emotions as a child and a growing adolescent. Sexual or physical abuse is also a hinted theory of where BPD comes from. Only 40 to 71% of people who actually suffer with BPD say that they have been physically or sexually abused. BPD has been very unheard of and has not had a bunch of awareness, and so the research is very little, but it is coming along, and the research does show that abuse can lead to personality disorders. Family instability, as in being around people in your family who did not handle their emotions well, does affect you and your environment that you grew up in. And general neglect will affect your outcome and can lead to BPD. Now, the symptoms of BPD. Dissociation is a very broad term. There are many parts of dissociation, which I will get to, but it's a disruption of the usually integrated functions of consciousness, memory, identity, or perception of the environment. Yes, I have a list of notes here because I can't remember anything. Haha, that also comes with BPD. So basically, and many scientists don't know how to correctly define and explain dissociation because it is so broad and many people experience it different ways. But there are two key points in dissociation. First one is depersonalization, and that's the feeling of separation from your body, as if you are watching your body in like a movie or a dream or an out-of-body experience, which I have felt, and it's very uncomfortable. Derealization is kind of being attached from the current moment that you are in the world, and that things that you usually find familiar are strange to you or look fake. In dissociation, there is derealization and depersonalization, which occur at the same time, and it's a very uncomfortable experience. And there are grounding techniques, which you can look up online for people who have BPD. If you want me to do a separate video on the ways that I have treated my BPD, please let me know. Common grounding technique is to look in your room and count 5 things that are real, or count 5 things that you hear, you taste, use your senses to connect back to the world. Other symptoms are fear of abandonment, unstable relationships, also the inability to keep a job just because of, I know that I really struggled with getting into work every day and getting on a routine because I fluctuate so much. But keeping a job with BPD is successful. There's no, correlation between being a person who doesn't work hard. So let's put that out there. There's an unclear or unstable self-image. I know for a while I don't know who I am. I don't know what I like. I don't know who my identity is. And if you watch my last video, I said that even with me having BPD, I have started to find myself. And a way I do that is I make lists. I write down what I like about myself. I write down what I like, and I try and remind myself and read back through those, which is why my journal, while as an art journal, is also a big part of my recovery. Self-harm, of course, is a really big factor of people who have BPD. I know that I struggled with it. I know people who have BPD right now that are struggling with self-harm. A person with BPD does have extreme emotional mood swings from happy to sad to angry all in one day. So when a typical person maybe doesn't have that many mood swings in a day, a person with BPD has felt depressed, manic, happy, angry, all of these things in one day, usually within a few hours of each other. So yes, having BPD is very exhausting, and for people who question, you don't do much in a day, why are you so exhausted? It's because instead of feeling 1 or 2 emotions per day, I'm feeling all of them. What is the treatment for BPD? So personally for me, I did cognitive behavior therapy, which is a way to reroute what you're feeling at a short term. It's kind of like it's not a long-term treatment, it's meant to be short. I actually have a therapy book, it is an activity book that helped me develop ways to control my emotions, reroute them, and handle my emotions and changes differently. It helps to change your behavior and thinking patterns. So I recommend cognitive behavior therapy. Recently there has been a therapy just made for BPD, which is called dialectical behavior therapy, or DBT. I will have links to the book I got for cognitive behavior therapy. I will have links down below for outreach centers for BPD, getting help with BPD, more information on BPD, the books that I used, and all that stuff to help you with BPD. Dialectical, I'm pretty much butchering the name, behavior therapy, or DBT, is teaching you skills to react to changes and events in your life. Because people with BPD don't really react well with change, like myself, we kind of need something that's going to help us figure out what to do with our emotions, because if something changes, we automatically go to, well, what impulsive thing can I do to cope? Like spending, binge eating, drinking, promiscuity, all that kinds of things. And the 4 main things that DBT focuses on is 1, mindfulness, and that is you being aware of your surroundings at the current moment, which I did use in therapy. Mindfulness really did help when I went to talk therapy and when I did cognitive behavior therapy on my own. Another thing is distress tolerance, and so it's how to tolerate pain instead of changing it, ignoring it, and acting out. Interpersonal effectiveness is how to say your own opinions, say what you want, or say no to people you idolize and still keep your self-respect and the relationship with that person healthy. Emotion regulation is how to change your emotions in a healthy way, how to go from angry to acceptance and things like that. There are a couple drugs, prescribed medicine that can help you, antidepressant and mood stabilizers if the BPD is depressed-based or anxiety-based, or antipsychotic medicine if there is a distortion in thinking. that is the majority of the problem with a person with BPD. But like I said, BPD affects every single person differently if you have it, so definitely going to your psychiatrist, talking out different ways, and finding what works for you. Like I said, what works for me is my antidepressants and my cognitive therapy. So if you know someone who has BPD, here's what to do to help them. You need to learn. You need to learn all about this disorder so that you can be educated and really know what it's about. You need to listen to them and be sympathetic, and especially be patient, because a person with BPD will ask you for reassurance all the time, and you just have to be patient and realize that's how their brain is functioning. You need to make sure the person feels heard, because if a person with BPD doesn't feel heard, they will get offended and might split on you. And if the person goes into an emotional kind of wreck and is having a episode, distract them, try and calm them down, and be there for them. But of course, take care of yourself. If a person with BPD is being completely too much on you, you need to let them know, because I don't ever want to put someone in an uncomfortable position. My mental illness is my responsibility to get help, and there are definitely hotlines and things that I can also go to. So remember that if it's too much for you, try and give them your support, but also don't combat your own mental illness. Stigmas and misconceptions that come along with BPD. Many people think that, one, people with BPD cannot live a normal life. While yes, BPD affects my life and many others in a huge way, we can still live a normal life. Wife, kids, all that stuff, or a husband with kids, or whatever. Have a job, have a career. With treatment and ways to recover, yes, I can live a normal life. People with BPD only threaten suicide to get attention. Actually, 10% of people who have BPD go through with suicide, and so make sure you take every threat of suicide very seriously. People with BPD are very manipulative, and so no. Mission causes premeditation, and people with BPD act in extreme ways to get attention and for their needs to be met. That is most time an impulse issue, and they're doing it because they feel like they're being abandoned and have to do something to get that attention. And while yes, it's a problem, and yes, it's not right, it is not manipulation, and the person is not trying to hurt you. People with BPD can't recover? No. People with BPD can recover. While the disorder itself is very hard to recover from and requires lots of time and effort, recovery is possible, and you are never too far gone to recover from this disorder. So that was my video about BPD and trying to spread some awareness for BPD. So make sure that if you have any questions, comments, concerns, you leave them down below. You check out my other social medias to stay in tune with what I'm doing. You subscribe, you like this video, and hit my bell notification so you don't miss when I post a video. Thank you so much everyone for watching, and those with BPD, we got this.